And welcome to the Dr. Bob Show. The heart is an amazing organ. It beats some 36 million times every year. What if you and I squeezed a ball 36 million times every year? Would our hand get tired? Would we get weak? Would we not squeeze as hard? We'll be talking about the heart and how the heart muscle works, and if it gets tired, what causes that? That's heart failure. My guest is Dr. Josh Todd. Dr. Todd is a board-certified cardiologist, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about high blood pressure, even though you don't have symptoms. What can it be doing to the brain and to the kidney and to the body? And if we have time, we'll also be talking about claudication, pain while walking in the calves of the leg. What causes it and what can we do about it? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Josh Todd, board-certified cardiologist, heart specialist, and we're going to be talking about heart failure. Josh, welcome to the Dr. Bob Show.
Thanks for having me again, Dr. Bob.
Tell me about the heart. It's such a special organ. Does it have special muscles? What kind of muscle structure?
Yeah, the heart obviously has a lot of work to do on a daily basis. The heart muscle both is a physical organ and it has to have contractility. It also carries electricity through it. So a lot of energy or oxygen is needed all the time with this organ because it has to do so much work.
Where does the heart muscle get its oxygen from?
So the heart muscle gets oxygen from the coronary arteries, which are the tubes that sit on top. It's kind of the sprinkler system on top of the garden. And that's established by your red cells that go feed blood flow to every other organ as well. Heart just uses a lot more oxygen than every other organ in your body.
So that's one of those reasons your coronary arteries are so important, that we keep those healthy so that the heart muscle stays healthy. When people, tell me about heart failure. What makes the heart lose its contractility?
Yeah, most of it in this country is related to the plumbing system within the heart. So heart artery blockages or coronary artery disease certainly can impair heart function. If you kind of think of it again as a garden or a patch of grass, not getting enough oxygen for a particular period of time can kill the heart muscle, or having significant blockages so that the heart muscle is dysfunctional for a short period of time, both of those can weaken the heart. That's probably 40 to 50% of who gets heart failure. The other group, the other half, is due to valvular disease, viruses can affect the heart, and 20 to 30% of them are the I don't know, heart muscle just becomes dysfunctional.
So there's really a lot of things that can make the heart muscle get tired.
Correct.
I like the analogy of the sprinkler system, the coronary artery supplying the blood and the oxygen to this muscle. So if that muscle is not getting adequate oxygen, it's just not beating as strong, it doesn't push out as much blood, what does it not
Correct.
do?
It kind of almost goes into a hibernation mode. And so, we struggle with this every day. Does putting an expensive sprinkler system in the heart make the heart muscle better? There are tests we can do to look to see how much of the heart muscle is dead. Various MRIs, echocardiograms, and nuclear studies. For the most part, though, it's sometimes the answer is we fix things and cross our fingers and hope the heart muscle does get better.
So what are the symptoms? If somebody's starting to have heart failure, is there a degree of symptoms that get worse and worse and worse? Early heart failure, what is it?
Yeah, early heart failure, and we kind of classify heart failure by different stages, 1 through 4. So early heart failure, sometimes a lot of people aren't that symptomatic. They may notice a little bit of shortness of breath with heavy exertional activity. As the heart muscle gets weaker and weaker, pressure goes up inside the heart because it can't move the fluid around. So you get more shorter breath with minimal activity. You have problems lying flat at night. You wake up in the middle of the night really short of breath. And then, along with that comes swelling in parts of the body. So the abdomen can swell and so can the legs.
So at this part, stage 2-ish, if I'm counting properly,
yes.
we're there. Why do people have trouble lying flat?
So the heart is a pretty strong organ. It certainly does pull blood flow from all your organs. The problem is we can't overcome gravity all the time. So as you lie flat, the blood pools in your lungs and the heart doesn't have enough squeeze to get things moved out of the lungs. Pressures go up and then you fart.
So when you elevate the head of the bed, that makes it where you don't have as much congestion in the lungs.
chest. It all pools in the legs, but you're able to breathe at that point. So
now I get short of breath when I'm active. If I climb stairs too fast, I get short of breath. I get short of breath if I chase something. Does that mean I'm getting heart failure?
No.
How do you know when it hits there?
Yeah, that's the hardest part, and that's where we have to rely on some diagnostic testing to see whether or not it's due to deconditioning, being out of shape, versus heart failure, versus sometimes those shortness of breath episodes can be due to heart artery blockages. So that's where I have to have a little more testing than just a history to determine that.
So before we go to the testing, let's go to stage 3. So right now we're short of breath with activity, less activity, more shortness of breath, lying flat, have to put on pillows. We used to call it paroxysmal nocturnal dyspnea.
Still do, yeah.
Still called
Right.
P&D.
Yeah.
We now, in allergy, we call that postnasal drainage.
gotcha. Okay.
So those acronyms sometimes mean different things.
Right.
So as we get worse, what happens? Start swelling?
Swelling, yeah, a lot of people back up and the liver starts to swell, and that can cause some swelling in the abdomen, and then later backs up in the legs. Some people find themselves more resistant to diuretics, so the Lasix, the things we use to help get fluid out. As the abdomen swells, sometimes they don't work as well once we start to retain more fluid as well.
At about stage 3, does almost everybody know that something's going wrong, that they're short of breath and they need some help somewhere for something?
Yeah, usually those are the people that will then present to the hospital or even our office really short of breath at that point in time. It's hard to function in stage 3 heart failure without medical treatment.
So what are some of the diagnostic tests that you have to find out if somebody's in stage 1, stage 2, or stage 3?
Yeah, the stages are all, to be honest with you, related to clinical symptoms. So it's first we get the history like everything else in medicine. But the first thing a lot of times people do is get an EKG. Now the electrical system of the heart doesn't necessarily tell me if the heart function is weak or not, but it will sometimes tell me if you've had old heart attacks. It'll tell me if you have certain rhythm disturbances associated with heart failure. Second test will be an ultrasound of the heart, where we'll most of the time do it from the chest wall. We put some jelly on your chest and take it from 2 different spots. And then at that point, based on what's called an ejection fraction, we'll take a look and decide whether or not it's heart failure system.
Ejection fraction means what?
What that means is the amount of blood your heart's supposed to squeeze out on every beat. Normal is anything over about half, so 50% or greater is considered a normal ejection fraction.
So that would be pretty good. If it's less than that, you're thinking about something's wrong with the heart muscle, perhaps.
Correct, yes.
Or with the coronary artery. So what is the next test? So you've got...
Next test, if we make a diagnosis of systolic heart failure, meaning the heart can't beat, systole is the term we use for contraction. So if the heart's not beating well, depending on the severity of it, if that number's in the 20% range, a lot of times we'll skip the stress testing and go straight to heart cath, because we need to really, a stress test doesn't tell you that they don't have severe blockages sometimes.
When you look at a heart cath and the heart muscle is not working as good, what do you see on the cath? Do you see the blood supply, the sprinkler system's not good? You see the muscle not pushing as strong? What do you see?
Yeah, so we do two studies in a heart cath. One is we'll put a catheter, a tube in the ventricle. We'll squirt a lot of dye in there to look at how well it's squeezing. That gives us an idea of ejection fraction, or if certain areas or segments of the walls aren't moving. When we look at the arteries, the sprinkler system, if the arteries are completely normal, then you're one of the 40–50% that doesn't have a blockage, meaning stents aren't going to improve your heart muscle. The other 50% that will, the answer is either we fix them with stents or we fix them with bypass surgery.
Is there a blood test for heart failure?
There's one called BNP, which is a brain natriuretic peptide. What that does is it tells me that the chambers in the heart are stretched. BNP can be elevated in a variety of reasons, though. So just because it's elevated doesn't mean you have heart failure. It's one of the diagnoses that we can consider.
So it's a test that you get if it's abnormal. You think more about heart failure,
Yes.
but it doesn't mean it. When somebody has heart failure, is there good treatment available?
Yeah, we've come a long way in the past, even 10 years, in terms of medical treatment for heart failure.
That's what we're going to be talking about when we come back. We've come a long way in the last 10 years on the treatment of heart failure. If you have shortness of breath with activity or the sprinkler system, your coronary arteries are not working well, what kind of treatment do you need? You'll want to stay tuned. We're talking with Dr. Josh Todd, board-certified cardiologist, heart specialist, and we're talking about the heart when it finally wears out. The sprinkler system would be the coronary arteries. I like that analogy. And the heart muscle in itself, for certain reasons, a previous heart attack or the sprinkler system not working, the muscle finally wears out and gets tired. Symptoms: shortness of breath, swelling of the feet, and now we're talking about treatment. So if you make the diagnosis of heart failure, how do you start treating the patient?
Yeah, I think important is why the heart is dysfunctional. So if it's due to the sprinkler system or heart artery blockages, the first step always is try to fix the blockages. So that can be either with stents or bypass surgery.
So if somebody has coronary artery disease and they need a stent, can you see heart failure almost go away when you fix it, that their heart really starts beating better and becomes more functional, or it's not that quick?
Symptoms do get better pretty quickly, especially if they're having a lot of chest pain or angina from the blockages. The heart muscle does take a little bit of time. After a heart attack setting, we don't even think about looking at the ejection fraction for at least 40 days. So sometimes it can take up to a month or two before we start seeing improvement in the heart function.
Are there some medicines, and I'm thinking of one specifically, that make it where the heart doesn't have to work as hard, lets it sort of regain that 40 days, its functionality? Beta blockers?
Yeah, certainly. I mean, we came 20, 30 years ago, we were scared of giving these medicines to patients with heart failure because we thought it would impair the function, but we figured out that over the long term, slowing down the heart rate, making it do less work, certainly improves function. So beta blockers are the #1 medicines we use. And then we have to talk about what the heart's having to do against the pressure in the body as well.
So let's drop back. I jumped ahead to beta blockers. What's the initial treatment for heart failure? You fix the problem, the coronary arteries, then what do you do?
So the big question is, again, why? If we fix the arteries, then that's the answer. We'll still initiate patients on medicines. Beta blockers are one of them. Fluid pills or diuretics. Most common one is Lasix we'll use to help with symptoms.
So what do diuretics do? How do they help the heart?
So the diuretics have never been proven to make you live longer. What they do is make you feel better. And I tell my patients diuretics get you out of bad eating decisions with salt. So the diuretics help get rid of salt in the kidneys. Water and salt like to hang out together, and so you dump water when you get rid of the salt from the kidneys.
So how about a low salt diet? How about a DASH diet? How about the diets that we have with low salt? Are those effective? Do people follow it? Can they follow those?
Yeah, they can. We've gone back and forth as cardiologists trying to figure out what's the optimal sodium dosing. The recommendations are still there. If you have systolic heart failure, try to stay around 2 to 3 grams of sodium. That being said, certain people are more salt sensitive than others. So I have patients that can get by with not doing it, and I have patients that can't do 1 gram of salt before they really start collecting water. So I think important with diuretic dosing is, I'd love it if I could pick the perfect dose every day, but it doesn't work that way, is doing daily weights and monitoring your symptoms. And sometimes we have to do sliding scale, meaning you take more diuretic on one day than you do the next.
So the diuretic gets rid of sodium. Sodium is the salt in the diet. So if we cut down on the salt, we use a diuretic, then we don't let the salt and the water hang around together to make the heart in failure.
Correct, yes.
So we correct that part. Do people, if they've got pitting edema, what's pitting edema mean?
Pitting edema just means that on exam, when I touch your legs, you can see a fingerprint, and so it leaves behind a pit with
So
pushing.
it leaves the finger. Is that a sign there's significant fluid?
Yeah, it can, again, with heart failure. Again, not all swelling of the feet is related to heart failure. So certainly we can have, obesity increases your risk of having venous insufficiency. Blood clots in the legs can do that, pulmonary hypertension or high blood pressure in the legs. So there's lots of reasons why fluid can back up on what we call the right side of the heart, or the veins in the heart.
Is it important to weigh people to see if they're holding on fluid or not?
Yeah, I tell most of my patients with heart failure to weigh daily. And if you gain more than 3 pounds in a day or 5 pounds within a couple
not
days,
food.
not food, you can't gain fat that quickly, take an extra dose of Lasix on that day.
So low salt, diuretics. What's the next treatment?
Next step is a class of agents called ACE inhibitors, okay? And what happens when you have heart failure? Your body is not trying to get you 5 years from now. It's trying to get you till tomorrow. To try to get your next meal, run from the bear or the lion that used to get us. And so what it does is it, again, holds on to salt and increases blood pressure artificially to try to maintain the output that your heart used to do. So we have medicines that block the hormonal aspects of that. It blocks aldosterone, which makes you hold on to salt, blocks something called an angiotensin converting enzyme that reduces blood pressure. But that allows the heart to pump against a low pressure system rather than a high pressure system.
So can you use a diuretic and an ACE inhibitor and a beta blocker all on one person?
Correct, yeah. And that's usually kind of the 3 food groups of heart failure that most people who have symptoms are going to be on.
So they have to be very, very careful. They take the medicines regular. How do you follow the heart to know if you're helping the patient get out of heart failure?
So usually what we'll do is we'll start them on a very low dose of these medicines. They all have the side effect of lowering blood pressure. So we'll start at low dose, and ideally you follow them up pretty quickly within 2 or 3 weeks. It's not one of those things where we put somebody on 1 dose of medicine, see them a year from now. 2 or 3 weeks, we try to increase the dose up to some goal recommendations based on what we use. And then once we get that medication up to target, we then will wait 2 or 3 months for the heart to kind of marinate in those medicines and then reassess with an echocardiogram.
The follow-up on a patient with heart failure, can you anticipate good results? Do you not know what you're going to get? What is the life expectancy? What do we think of when somebody has, now we're at stage 1, 2, 3. We're at 3 now, and I haven't hit 4.
Right. Mm-hmm. So, there's several things we look at. Yes, stage of heart failure is important, and that more looks at functional capacity of the patient. That plus what we do, a 6-minute walk test, how far you can walk in 6 minutes, is probably more predictable in terms of outcome or prognosis than what your ejection fraction is.
So you take them outside and say, start walking?
Or we have these 50-meter, location. We just time them for 6 minutes. They walk back and forth in the office, and we count how many times they do it.
You sit there with the whip and say, walk faster?
I try not to, but patients are usually pretty motivated. They want to beat their record, etc.
And after their 6 minutes of walking, what are you looking for?
We calculate how far they're able to walk. There are certain thresholds at which we're more nervous or think about referral to more, tertiary centers that can do supportive care with heart transplants and heart mechanical devices. Again, a lot of times let's look at a baseline to see where you are, to see if we're getting better with medical therapy too. So we use that information to change a lot of decisions that we make.
So if somebody has heart failure and they're on a diuretic and they're on an ACE inhibitor and a beta blocker and they can walk 6 minutes pretty good and they do pretty well, what's the biggest problem, the biggest hurdle they have of getting back into heart failure?
Part of it, one, is dietary indiscretion. Compliance with medications, I would say, are the number 1 and 2 problems I see with people. New blockages can always pop up. It's not that new blockages pop up within the year, but if you've had a stent, 5 years from now, heart's more dysfunctional. A lot of times we have progression of blockages. So, a lot of times it's all about preventing cardiovascular disease as well as being on the medicines for heart failure too.
The overall lifestyle, if somebody's heart failure, they're doing well on the medications, do you have them exercise? Do you have them improve their heart function by activity?
Yeah, cardiac rehabilitation is pretty important now, and the insurance companies now have gotten into this, Medicare especially too, has said if you exercise and we get you in a program, you're less likely to be readmitted with hospital, do better, have a better prognosis. So that's certainly important.
Josh, I'm not going to get into stage 4 right now. We haven't got time, but I think the teaching that you've given us, the importance of knowing how the sprinkler system's working, how the heart muscle's working, looking at the function of the heart, and then starting with diuretics and low salt and ACE inhibitors and beta blockers. What a great treatment that you have available for these patients. I want to thank you for being a cardiologist, for helping people in heart failure, and coming to the Dr. Bob Show.
Thanks again for having me, Dr. Bob.
A lot of information for you. If you or somebody in your family has had heart failure, retape this show, re-listen to the things that you can do to live a more productive and a happier life. And now you want to stay tuned. We're going to be talking about what happens with high blood pressure and you don't even know you have it. How could it be harming the body? And claudication, what is that and what can we do for it? A lot of information for you. I want to thank Dr. Josh Todd. Wonderful discussion on heart failure and what we can do about it. Now for questions from you, the viewer, that I think will be important to your health. Question number 1. Dr. Bob, what are the harmful effects of high blood pressure? My doctor says I have high blood pressure, but I feel fine. There's several educational points with that. Number 1, high blood pressure can be a silent killer. People do not know when their blood pressure is high. They cannot feel a high blood pressure. So every time you see your doctor, you should be sure that you get your blood pressure taken. If your blood pressure is above 130, the upper number, or above 85, the lower number, then you've got high blood pressure, especially if it's that on at least 2 occasions. So with that, you need to work out a program with your doctor on treating hypertension. It's a very treatable illness. What are some of the problems and the harmful side effects that high blood pressure, even though it's silent, can cause? Well, number 1, it can cause problems in the brain. If the blood pressure is too high, we could either have a stroke where the blood vessels burst in the brain, or the constant beating on those blood vessels allow for cholesterol to be deposited. And so we get some hardening of the arteries in the brain that can cause dementia, early problems with thinking, and early brain problems. It does the same thing when we walk down to other organs of the heart. And so in the coronary vessels, high blood pressure can do the same thing. Down on the kidney, the constant beating of high blood pressure on the blood vessels that supply blood to the kidney so that the kidneys can take the bad stuff out of the blood and can filter it out in the urine. All of those become abnormal, all because we have high blood pressure. So high blood pressure is something that we don't want to mess around with. If you have high blood pressure, work that out with your doctor. There's excellent medicines. Cut down on your salt, use blood pressure medications, get regular checkups, get your own blood pressure cuff. Know what your blood pressure is at home if you've got high blood pressure. It's a very important thing for you to treat. Question number 2. Dr. Bob, I have leg cramps while I'm walking and it gets better when I rest. Well, you've made the diagnosis. The diagnosis is claudication. And what happens is when you're walking, the muscles in the leg need adequate blood supply. If they don't have adequate blood supply, then the muscles begin to cramp. That's called claudication. So it's the same problem going on in the blood vessels to the calf muscles that go to the rest of the body. If they get hardening of the arteries, if they get cholesterol deposition, and usually that will be associated with high blood pressure, angina, heart problems. So claudication is a warning sign that the blood vessels in the other parts of your body are also being damaged. The big vessel that goes down in the middle of the abdomen, the abdominal aorta, we can get aneurysms ballooning out in that. We get hardening of the arteries that go to the kidneys. So it's just like, how does high blood pressure cause problems? Well, it damages the blood vessels and the blood vessels to the calves of the legs. So when we stop walking and we rest, then we get the nourishment back to the calf muscles and we feel good until we start walking again. So there are some grafts, some bypass surgery, some endovascular surgery that can open up the arteries that go to the lower extremities, to the calf muscles and to the feet. So if you're having those symptoms, talk that over with your doctor. He'll do special tests. And indeed, if you do have blockage of the arteries that are going to your lower extremities, know that there's plenty of things that the doctors can do to get that better. It's all the time that we have for this show. Now I'm thinking the 4 things that we talk about at the end of the Dr. Bob Show, which is the most important: exercise, adequate sleep, eating properly, or laughter. You know, it's the combination of all those things. Sometimes I think if we could just pick one, it would be exercise, because exercise helps us lose weight, it helps us feel better. You get a runner's high, you get endorphins and kephalins that make us feel better. It makes the heart get new circulation around it. So exercise, without a question, is wonderful for us. But if we don't get 7 hours of good sleep, we don't perform well. And so you need to have, as well as exercise, you need to be sleeping properly. And you need to, if you're having bad night's sleep frequently, you have to work that out with your doctor and work it out maybe with a sleep specialist. And eating properly really develops the body size and shape and activity that we want. So be sure that you look at the volume of food that you eat, the type of food that you eat. Be sure that you don't overeat. When you sit down in a meal, know how much you're going to eat beforehand. And that laughter in your life, how important is that? Giggle, laugh a lot, have fun, enjoy yourself, and you'll be healthy.